welcome to this short presentation on the success of the Yellow Card scheme. Since it was introduced in the early 1960s, analysis of the data collected via the Yellow Card scheme has enabled the MHRA to detect a number of important safety concerns. The Yellow Card scheme is not the only source of evidence to the MHRA on drug safety, but it is an important source of signals. These are suspicions that there may be a potential problem with a drug. Each report of a serious reaction, or a reaction to a black triangle drug, or of a reaction in a child, is considered by an experienced assessor. If there also appears to be a collection of reactions with established drugs, then these can also be put on alert status. If a signal, which is the identification of a possible problem, is detected, then the MHRA will collect further sources of evidence about the drug, and the reaction will be researched, and also they will carry out an impact assessment. This will look at how important the reaction might be. Is the drug used for a serious disease? Are other drugs available that could be used instead? Is the reaction likely in the general population, e.g. if it's a vaccine, or a restricted group, for example the elderly? And when all the evidence is considered, do the benefits of taking the drug still outweigh the risks? The information may allow a drug to remain on the market if it can be used safely with restrictions, rather than a blanket withdrawal. After analysis, if the signal is considered to be real and of high priority, the information will be sent to the Commission on Human Medicines for regulatory advice. Vigabatrin was first marketed as a treatment for epilepsy in the UK in 1989. When the drug was licensed, there were rare incidences of visual field problems and retinal disorders, which were noted at a rate of less than 1 in 1,000. In 1997, 3 cases of severe, symptomatic, persistent visual field constriction associated with vigabatrin treatment were described after about 2 to 3 years of treatment. These were included in the 9 cases the MHRA had in the Yellow Card database. This is an example of an adverse reaction detected after chronic treatment, and these can be difficult to link with the drug. The regulatory action the MHRA took was that the drug should only be initiated by a specialist where other drugs had been ineffective, and at a maximum dose of 3 grams per day in adults, and that it should be withdrawn if proved ineffective. The MHRA also collects data on adverse reactions to herbal products, both licensed and unlicensed. In 2004, the MHRA had received 10 reports of adverse reactions in patients who had been taking black cohosh, mostly to treat menopausal symptoms. The first of these reports was received in 1998, and 7 of these reports concerned hepatotoxicity, including 1 case of life-threatening hepatitis with cholestatic jaundice. The MHRA requested that a warning was put in the product information, and they sent a letter to all herbal manufacturers to draw attention to this problem. Subsequently, in the last few years, the MHRA became aware that some unlicensed products containing black cohosh may not have had this warning, and they issued a reminder to the sector of the need to carry appropriate warnings on their product labelling. Varenicline was introduced in the United Kingdom in 2006. As a black triangle drug, reporters were asked to report all reactions. 12 months after introduction, there had been 36 reports of suicidal thoughts received out of a total of 1,241 Yellow Card reports. As this drug was marketed through the centralised EU procedure, action was taken at an EU level to update the product information to contain warnings that depression has been reported in patients using varenicline who are trying to stop smoking, and that symptoms of depression may include suicidal thoughts and behaviour, and to carefully monitor patients with a history of psychiatric illness. There are many other examples of the impact of the yellow card scheme on drug safety. For the scheme to work, reports are required for as long as the drug remains on the market. Information contained in a report may add new detail to an already known reaction and allow a drug to be used more safely. In conclusion, we would ask you to please remain vigilant for the possibility of an adverse reaction in a patient. There are other presentations in this series on different aspects of the yellow card scheme, and they can be found on our website.